Yes, yeah. So SARS is COVID-1, and then this one today is COVID-2.
Okay.
Okay, so let me go back. It's all in the same. So we got to this point, and let's look at uh, the next slide here. We just did this. So it's ever changing. So uh, uh, a couple of days ago or 3 days ago, we had 100 deaths. And then the next day, we had 249 deaths. See how it's doubling up? That's
Mhm.
just in death. We haven't even looked at how many people that's walking around without the symptoms who's spreading every 3 people at a time.
Right.
It's that's how they looked at this. It's not one on one like influenza. It's that you get one person, that person that day would have infected 3 people.
So how is it that other countries have had enough tests to test everybody in the country, but our country hasn't?
No, they're not basing off of tests. They're basing off of like China. China's communist. You have to follow the shelter in place. You get it?
Yes.
So if you don't follow, you get shot.
Right.
Wow.
Do you get it? Because it might as well shoot you because you're gonna get what 20 infected, and you're gonna kill someone. So you're actually a murderer.
Yes.
In a sense,
Right.
right? So
Yeah. Yeah.
I told Dr. NHK. Is that your name, Dr. NHK?
Yeah, go ahead.
Nelson there. Nelson Kwong. Um, are you listening?
I'm listening.
Dr. Kwong, what was it in January? I said that I gave my recommendation to CDC, and my
Mm-hmm.
recommendation was, what was my recommendation?
Travel ban.
Yep,
Yeah.
locally and internationally.
I remember that.
That's the only way you're going to stop this. So those who are there at home, there's 18 of you there, I think. You're doing the right thing. And I think I'm doing a service to the community. I'm keeping you at home. So I think people should take classes online to keep themselves busy instead of, trying to figure out what's the next thing you got to clean in your house.
Yeah, I have one question because I do have to go out for my client to pick up prescriptions or, for food, just the basic necessities. And I do wear gloves and I change them out. But as far as the mask, are those reusable or are we supposed to use a new mask every time we go out?
All right. Let's talk about, since you posed that question, is everybody listening? Please listen because I'm going to do a count check if you guys, I'll do a little quiz, just the oral quiz if you understood what we're talking about because it's important. Let's talk about the mass. Okay. Now, there are different types of masks. There's class 1, class 2, class 3. Then you got the ultimate mask, was the N95. Okay, 95% effective in the virus going through the mass.
Hmm.
Okay, so the ultimate of a mask is a face shield and a face mask inside. Okay, whether it's a surgical mask or a N95 mask. Now N95 is just saying that it has it's class 3 on. It's better than the ones that the surgical masks are. So of course the class 3 and N95 is better, but uh, um, those are used mainly in a highly infected area. And where is the highly infected area, guys?
Hospitals.
Yes, in the hospital where you got people coming in,
That's
and those
already
guys,
sick.
yes, those guys need the N95s. Okay, and they need a face shield because those droplets can drop in the face mask as the face mask gets wet from your breathing, right? The pores of the face mask opens up and the virus will come in. Make sense?
Yes.
So they're not only wearing the face mask in the hospital, they have to wear a face shield because it's in the WHO says that in a concentrated area like the ER, the intensive care unit, and where they're using respirators, they're using all these aerolized type of potentials, intubation or whatnot, like somebody says, it's going to cause airborne. Okay, airborne. So unless it's a negative pressure room, you will now concentrate the hospital of the air there. Not much hospitals have HEPA filters in their air conditioning. So, in order to really decrease the droplet and airborne, you have to put a negative pressure room. A negative pressure room means that it sucks the air out and never returns it back. Okay, that's a negative pressure room. So it's a double door room where a nurse will have to come first, get suited up, and come in. And then when they get out, they get unsuited or duffing all their PPEs, and then get out. The doors doesn't escape the air coming from the second door. Okay, so those are negative. And how many negative pressure rooms are in the hospital?
Not very many.
One or two or three. Kaiser Antioch only has what? I think 5 or 6.
In our unit, we have like 10.
Where's that?
San Francisco General.
Well, see, that's a bigger hospital. You see? Yeah, they're prepared, but having 10 and you have what, 100 cases, who are you going to choose to go in there? Right?
Right.
So me and Nelson were saying, hey, let's make a hospital with every room with negative pressure.
Yeah.
That's a good idea.
Yeah. The whole hospital, negative pressure. Everybody's double door.
It would take time.
So what would be the cost in that though, doctor?
It's not as much. It's not as much cost. Extra 10.
I'm wondering why they don't do that already.
Because they're old hospitals, okay, and nobody set the guidelines.
Mm-hmm.
The guidelines, because we don't have a pandemic every year.
Right.
So why? We should be prepared. Like if somebody was building a hospital.
Right, that's what I'm saying. Better safe than sorry, right?
Right. So if somebody's building a new hospital, like let's say Kaiser builds a new hospital, the new code should be set in place.
Absolutely.
Yeah,
absolutely. I agree. I concur.
Yeah. The new code saying, hey, you have the 50% of your beds have to be negative pressure rooms.
Well, that was going to be my next question. Say we get through this, and we're going to get through this. I believe we're going to get through this. Minus a lot of people. A lot of people are not going to come with. But how do we start over again? What would be the guidelines? Are there going to be new rules put in place? We're going to have to live a different way now.
Yeah, we're going to have to live a different way because in the next couple of years, you know how we shake people's hands. We're going to be like Japan. You know how they go?
Right.
Right. You just hold your hand. You just, sayonara, that kind of thing.
Absolutely.
You bow like the Prince Charles. Prince Charles now is positive for Corona. We got a lot of, important.
Socialization is going to change as far as gatherings and people being in an environment with more than, maybe 15 people.
Right,
that
right.
kind of thing.
Here's the thing.
Classroom settings will be different as well.
Here's my take on it. You know how all of you guys like going to a buffet?
No.
Okay, wait. Let me just explain. Some of you guys been to a buffet and now you don't want to go to a buffet. I will restrict. If I was a mayor in the city, I will not give a permit to a buffet.
Mm-hmm.
I agree.
Why?
Absolutely.
You're touching the utensil from one person to the next.
Yes, I agree.
I always hated buffets, Dr. Nieto. I have to be. I never went to one. I did not.
So me and Nelson's gonna put up a buffet, but our buffet every food item is served by a server. You get it?
Yes.
With the proper PPE. So if you want that particular item, they would put it in your plate.
Right.
Okay, that's a great idea. I like that.
Oh, hell yeah. That's why I'm here, right?
Right. There you go. See, look, that's what I like. Now, you can eat at that buffet. I agree.
Right. So having, those types of codes and whatnot, like building a hospital, don't give the permit unless the plan shows that they have X amount of negative pressure rooms.
Wow.
You get it? X amount of ventilation or ventilators, that kind of thing. And I'll be talking about respirators and ventilators. So is it a matter of that they're expensive to make or something, or why don't we have like they already know that the hospital can hold so many people, right? Right. When they build the hospital, they have rooms for so many people, so many beds. Right. So they don't anticipate that they're going to need a ventilator per bed or something like that when they build the hospital.
They're not thinking there's going to be a huge pandemic.
Right. So all you guys are right.
But I think, like Dr. Nieto says, we should be prepared at all costs. You just never know. Correct. So, we could, if we impose a code that all these potential or all these negative pressure should have a respirator or ventilator on it. Right. Okay. Right. So it's when the inspector comes in, okay, here's your negative pressure room. Where's your ventilator? Right. Where's your respirator? Right. So it's already built in. And through technology, a ventilator now could be as big as a a microwave now. Unlike before, it's 3 foot tall and all that stuff.
Real quick, going back to the mask, real quick. I just wanted to know if they're reusable or after we use them.
The respirator?
The mask.
The mask.
I think it depends on the kind that you have, right?
If you're not in a critical area like a hospital, the hospital should not reuse it because the virus is already stuck on the top.
No, like if I'm just going to pick up a prescription.
You know what? I'm not going to advocate reusing.
Okay.
Mm-mm.
I was going to say no.
Because there's a potential. There's a potential.
Yes.
If I say yes and then you get it, then you sue me, right?
Right. Right.
I won't sue you, Dr. Nieto. You're too much of a good doctor.
Okay, thanks. All right. So is everybody okay so far? Or what time is it? 10 o'clock.
10 o'clock.
In a few minutes, we'll take a break, but let me go get some more PowerPoint in here, okay? Because we have to get through this. All right. So you see the cases there. It's going to ever increase. I think we'll reach 1 million cases by next week and doubling the death, okay? As other countries are rising now, okay? The states that are rising now is Michigan and Illinois and Louisiana. There are more states now. I think 13 states applied for disaster area already with New York and California and Washington. So they're in lockdown now. So we're nowhere close of what the government wants us to go back to work by April 1st. And April 1st is on Wednesday, okay?
Yeah.
I don't think we're going to make it.
We're not ready.
In terms of the Louisiana, their cases increased a great deal because of the Mardi Gras.
No, that's true.
The news.
That's true. See, it's the
What?
same. It's the same. Is the same idea with Wuhan when everybody went to the Chinese New Year.
Yes.
Or the back to in where America and all the other countries have December off, and they'll go back to their country.
Yep.
Okay, that's why they canceled what in February the Chinese New Year celebration here in San Francisco.
That's right.
Okay, so let's move on. I know you guys are listening there. Thanks for listening still. So, what's on the rise? Okay, you guys taken my CE class in the last 2, 3 years, 4 years, 5 years, 6 years. Some of you have been here with me for the last 15 years. My God, thank you very much. We talk about infection, we talk about measles and Zika and the flu. We talk about what's emerging, and I'm not even going to talk about measles and Zika and the flu. We have so much information, we don't have enough time to explain everything to you with the coronavirus, because we don't even have that much information to give you, really. It's only based on what we're seeing now. These things can change. You get it? The numbers can change. The ideas will change. The perception will change as we get past this. And then we look back and say, okay, we were wrong. Oh, we were right. We were wrong. We were right. Until we get all the data together, and then we can write a book about this. Okay? All right. So, I can't emphasize enough of vaccines. So when we do get a vaccine in the next 6 months to a year, I suggest everybody gets it, okay? And those people who survive this season or this outbreak, this pandemic, they're lucky because they are now immune to corona, okay? In caution. They are going to be immune to this one strain, okay? So if the next outbreak comes, the next outbreak of coronavirus, the second flow, those guys are lucky, they are protected, unless, I quote, unless the coronavirus becomes mutated and become a new virus. Are we clear?
Yes.
Okay. So then they're half protected. Okay. Those people that got the infection, they're half protected. So they would need the vaccine as well, because the vaccine will have all the different mutated ones in there. Are we clear?
Yes.
All right. So let's go. So here's the coronavirus. It has these spicules like a crown. That's why we call it corona, because of the crown-looking thing. Like, everybody is like Miss Universe there, There's Miss Africa, Miss Philippines, everybody has a crown, all right? And that crown is the funny thing about it. That crown has the protein receptor to attach to the cells in our body, especially the pneumocyte in the lungs, called pneumocyte 2, where it destroys the endothelial cell of the lung. Okay? And it matches that receptor on those cells. So that's why this virus is able to stick and cause disease. These little spicules here that you see these spicules right there?
Yes.
Yeah, these are receptor sites for any cell in our body. And especially, this is a respiratory disease. It gets in your throat, then it gets into your alveoli, and your alveoli has 2 cells in there, a thin cell layer of the sac, which is called pneumocyte 1 and 2. And it affects the 2 that decreases your surfactant, and your surfactant is there so that your air sacs doesn't collapse. So if we don't have the surfactant, what happens to your lung? It collapses.
Mm-hmm.
That's why there's death. People can't breathe without that respirator or ventilator. Are we clear?
Yes.
Okay, so that's why whoever designed this disease, man, got it right. Because I'm going to explain to you later in this lecture that someone wanted to kill the whole population. Okay?
Right.
And if you look at it, look at this.
So you believe that this is a man-made disease? Because a lot of people are trying to say it's from certain animals like bats or a pangolin.
No, you're right. You're right. For this coronavirus, they're focusing on the pangolin, but it all came from the bat. But as man gets closer to those secondary reservoir, those animals, it transformed into a human virus. So first, it's a zoonotic virus where we don't, even though we're close to it, we won't get. But once it transforms and people eat the virus or eat the animal or live with that animal, that virus transforms into a human virus. Okay? And now man gets sick. It transforms. So man can't give it to an animal now. You get it?
Right.
It's man to man now. Okay? So, if we were to design a virus that will, decrease the population, this is the virus. Because why? As we look at the data from China, the majority of the deaths are the population that can procreate and give life, and that's man. So there's more men dying. If you don't have man, how are you gonna fertilize the egg?
Right.
You get it? So you're gonna decrease the population. Okay, so I don't know. There's a lot of hearsay about this is a man-made virus. And this is the perfect storm virus of a pandemic. Now we're smarter now. A lot of scientists are studying this, and that's why I'm showing you this picture. Those spicules, those crowns, are the culprit of sticking to a cell. Okay, sticking to a cell. Okay, and that cell is tricked. When that cell is tricked with sticking on, it thinks it's a problem, and it'll engulf it. Once it engulfs it, this virus will make more virus inside your cell. So in a sense, a virus is a parasite. It uses your cell to reproduce itself. Okay? That's what we call an intracellular parasite. Until he infects all the white cells, then you lose all the white cells and stuff. So your lymphocyte starts going down, and pretty soon you have no immunity. It's almost like HIV. Okay? It's almost like HIV. But the worst thing about this, it sticks to your lung cell. Okay? It sticks to your lung cell. So, and if it sticks to your lung cell, you can't breathe, you die. And what's the normal course of death is anywhere from 10 days to 28 days that we're looking at. Okay? And part and partial, we don't have the resource. Good ventilators, perfect ventilators, perfect respirators and whatnot. We don't have the best medicine for it because we don't know. We're just doing what we call RCT.
I think I got like 2 because I had them when they did that fire. When the fire. Yeah. Yeah.
What was that? Wanda, what did you say?
That wasn't me.
Oh, it wasn't. Sorry.
No, I'm just sitting here listening.
Okay, who was saying that?
I think they're just talking in the background.
Oh, talking in the background. Okay. They're probably at work or something. Okay. Anyway, so our problem is this virus actually will stick. It has a receptor for the human cell. Okay, and if it sticks, the disease will occur. Okay, so we got to find a vaccine so that it doesn't stick to a human cell. That's our big dilemma or our big research on it. Okay, so many companies are fighting to be the first vaccine because it's going to be a Nobel Peace Prize, a prize if somebody discovers the first vaccine on it. Okay, all right.
Mm.
All right, so you see there's pictures there. It's an RNA virus. That means it's a genetic protein where that RNA can go to a ribosome and produce another RNA. Okay, so that's why it can reproduce itself and produce all the different proteins, nucleoproteins and cytoplasmic proteins and the organelles to reproduce another virus. So your body, your cell actually makes the virus for the corona. Okay, it makes the DNA, the RNA, and creates that nucleic acid to reproduce the next virus. So man becomes the reproducer.
I
Okay?
have a question, doctor. So when you first get this virus, does it attack the lymph nodes?
Let me explain what your question is. It doesn't attack the lymph nodes. Okay, it's not like Epstein-Barr virus where it attacks the lymph nodes. This actually it creates a reaction. So what we have in our lungs are cells called macrophage. Okay, and macrophage in our respiratory tract is a surveillance cell where if there is a foreign matter, it will secrete cytokine. And cytokine will trigger your immune response. Okay? Your immune response. So it will signal first the interleukin cell number 6. And number 6 will cause fever, a fever of 100.4. Okay, please take note that 100.4 is a fever for coronavirus. Okay, so when it attacks the macrophage, it will release this cytokine to tell your immune system, "Hey, I need help." So all the cells starts coming, your lymphocytes, your neutrophils, all your thromboxane to flood the area. When I say flood the area, that's what? Inflammation. You got it? So it's going to cause what? Pus formation, water. You're gonna have extravagation of water into the interstitial system or in the interstitial area of the lungs. So the part where there's no air sacs. In between those air sac, water accumulates in between the air sac, right, like that. Okay, so now you can't it can't dilate. So and then pretty soon, excuse me, water accumulates inside the air sac. So now the lung becomes stiff. So we need a respirator to push air into it. Okay, so there's a lot of science to this, but I'll explain in the next few slides. Okay.
Okay.
All right. I thought you were supposed to leave. Maria, I thought you were supposed to leave.
I'm supposed to leave?
Yeah.
So you're playing.
I need some water. All right. So it does start first as a dry cough, guys. So if you're having dry cough, please don't mistake it as a seasonal cough. Seasonal cough are more phlegm producing or productive cough. Okay? So if you have phlegm there, then it's most likely not corona. This is more of a dry cough, and then that dry cough, if you don't swallow enough during that day, it goes into your tracheal air windpipe. As that virus goes into your trachea, it's now going down your lungs. So there's some scientists in the world saying, you know, if you drink constantly every day, you're washing it down your stomach. And if you wash down the virus down your stomach, you might get a diarrhea and not get infected, but most of the time the virus will be killed from your gastric acid. Okay? So that's why it's not a GI or a UTI system problem. It's more of a respiratory problem. And
Dr. Nieto,
yes.
this is Wanda Johnson.
Yes.
I just got diagnosed like 3 weeks ago with a respiratory infection.
Okay.
It started off as a cold, and then it was an upper respiratory infection, and then it turned into a lower tract infection.
Okay.
And they gave me like 5 different antibiotics.
So it was a bacterial.
Yeah.
Okay.
But I experienced the flushing of the system, and then the diarrhea, and I still have a cough, but I feel like 100% better. And I've been tested for the coronavirus.
And negative.
Yes.
Yeah. So more or less, you probably have a whether it's influenza or bacterial. So if the doctor gave you antibiotics, it's more likely a bacterial, unless you got
They
a
said
second.
It was called the rhinovirus.
It's a viral. So they're trying to treat you with secondary infection. You get it?
Yeah.
The initial was viral. And they want to protect you with a secondary infection regimen, which will be your antibiotics, because we don't really have a treatment for viruses. Even though we have a lot of antivirals now, viruses take their course, and some of these antivirals help a little bit, but your body, will take care of the rest. Okay. Right. So for coronavirus, if you can't breathe, how's it going to take care of itself? You know what I mean? It's already in its worst condition, or its terminal stage, if you get lots of water in the lungs. Okay. And I'll explain about from pneumonia to the coronavirus, death of the coronavirus in the lungs is your ARDS. That's your acute respiratory disease syndrome. Okay, and that's ultimately how you would die, because at that point you would need a ventilator respirator. Okay, are we clear?
Yeah.
Yes.
Okay, so it's like mild. Some people, get the symptoms and it goes away in 7 days, 14 days, and never knew they had it. So, but we could test people now. Okay, in the next couple of months, we're going to start testing people before we start doing the vaccines, where you're going to come in, we're going to take your blood now. When we take your blood, we're not checking for, the virus. We're checking for your response to the virus, your immune response. And that's what we call your antibodies against the coronavirus. You get it? Mm-hmm. So what we do is, let me draw it. I'll show you how I'll draw it. If this was a bunch of viruses here, I can't draw right, but anyway, Pretend that's a virus. And then we're going to make the same protein in the lab that mimics this virus, but it's not infective. It's a live attenuated virus. And then we get the person's blood. Here's the person's blood, and the person's blood will have antibodies that look like these Mercedes-Benz type of design, okay? Like that. So we put this antigen here, and these are antibodies, okay? Antibodies. And then if you were positive, and this is the corona virus here, if you were positive, these viruses will connect here at the FAB portion, and we could count these, how much antibodies you have produced in the last 6 months. Okay, so we're going to do a lot of testing now. We're going to say, hey, you could check for your antibodies, see if you're covered. Okay, because we didn't test you earlier. We didn't have enough tests. So we could check now if you have some immunity. Okay, this is your immune response of antigen antibody complex. Okay, are we clear with that?
Yes.
All right, cool. All right, and I'm going to talk really high end here, but try to ask me a question. If you don't understand, I'll explain it another way. Okay, all right. So let's go forward. So usually the costs about 15 common cold, usually in the winter months. Now we could debate this now. We could debate this. Look at this, I'm gonna debate you. They said in the winter months. So this data has changed because Singapore and the Philippines has it. And what's the temperature in Singapore and Philippines? Right? It's what? Hot and humid.
I saw something in the news last night that heat kills the coronavirus, but heat like boiling, like when you boil water kind of heat, that hot.
Right, it has to be that hot. But look at, they're saying it's only in the winter months last month. But look at that. How come Singapore and Philippines has it, and they're in the tropical equator where it's hot and humid? It's now in Africa. You get it?
Yeah.
So we can't play with that rule. Like an influenza virus. You get it? We can't play with that rule. So everything is changing. That's why I wanted to give this lecture that I made last month, and I'm going to try to disprove it now. Okay, and this is the disproof of President Trump is saying, oh, when we get into the summer months, the virus will go away like as if nothing happened. Well, you better think again. Until we get there, we'll say it. But since we're not there yet, and Philippines and Singapore is in a hot country, how come they're getting it? It's not even winter month. They don't have winter in the equator area. Okay, all right, are we clear with that?
Yes.
Okay, so are you guys learning something?
Absolutely.
Okay, good. So we'll explain about pneumonia, where it's different from ARDS. I'll have a picture of the x-ray of a lung later, and we'll look at how the immune system becomes weaker and weaker, as explained by the lymphocytes. So as phlebotomists, you guys draw blood. So when the doctor requests for a CBC differential, you know that we're looking at the population of white blood cells. And in coronavirus, CBC differential, we're looking at all the white blood cells and counting it, right? And one that I taught you guys in phlebotomy, that lymphocytes, if it increases, you're having a a viral infection. Remember that? Okay.
White blood cells?
Yeah. So if lymphocytes go
Yes.
up, you're getting a viral infection, which is corona, correct?
Yes.
But check this out. In corona, it's the other way around.
Oh.
That's why it's crazy. Corona, the lymphocytes actually go down.
Because they're getting eaten.
Yes, thank you very much for listening.
Good
Lymphocytes
job.
actually goes down because, and that term is lymphopenia. You get it? I spell it right.
They're losing the battle.
Yeah, they're getting infected. So every time a coronavirus goes into a lymphocyte, it kills it. So it actually goes down like what?
Like AIDS. See, okay, my question is, okay, for example, the herpes virus.
Uh-huh.
The herpes virus, like, it also, it attacks the lymph nodes, but it's able to survive in your body and not kill you, but there's no cure for it.
Well, see, herpes virus is actually the predilection of system is the what? The skin, yes?
Yes.
Then it doesn't go away. Okay, it doesn't go away. It stays in your body. Only comes out. Only comes out.
To the nervous system, right?
Yes, to the nervous system, as correct. Comes out when what? When?
Yeah, but outbreak.
Not an outbreak, but when?
No, people are stressed when herpes shows up in your body.
Yeah, what is that? What I just typed?
Immunity
Goes down.
goes down.
Exactly.
Yes.
So let's look at herpes virus. When you guys have fever, like let's say for a influenza, 3 days later you got what? A cold sore.
Right.
And cold sore is herpes virus.
Right.
Do you get it?
Yes.
So this is not a respiratory problem. It's a skin problem.
It's a skin problem.
Oh, okay.
So it's totally different. So corona is only a few viruses that hit the respiratory tract. And every year we get one of them, which is the rhinovirus. That's your common cold.
Right.
Rhinovirus is your common cold. And then this silent one among the group of respiratory virus is the coronavirus, which has been silent for the last, 19 years, 15 years, when we have the SARS and the MERS.
Right.
And now we have a strain now that it's actually faster than these two and faster than influenza respiratory virus. Do you get it?
Yes.
So if you look at my book here, I have a book. See, this is what I used in is it backwards? I use in at the Cal State East Bay when I was teaching, and there's only a few pages on coronavirus. So there's new data. So I'm pretty sure when the new book comes out, there will be like 20 pages on coronavirus.
Okay.
Do you get it?
Yes. One more thing I've been hearing from doctors also is to completely stay away from Advil and anti-inflammatories, that it makes the coronavirus 10 times worse.
Ibuprofen. Okay, the ibuprofen, like what is the ibuprofen? Advil is ibuprofen. Yeah.
Right.
Yeah. So, yeah, there's a mechanism there that we're trying to study now. I don't want to give you the mechanism yet because it's not fully studied. You know, I can mention a lot of things today, but still, if there is no enough data to concretely say it does what it does. Are we clear?
Yes.
Okay, so whatever you hear in the news, hey, it's working for one person, but it might not work for another person, is what I'm trying to say.
Okay.
Until we get enough data. You know, they're saying azithromycin and a antiviral together helps it. ACE inhibitor helps it. But, you know, there's many different cultures, many different countries. You know, we have different genetics. We don't know. It might work for one country and not work for the other country. Are we clear?
Yes.
How about the malaria medicine?
The chloroquine. Okay, so I'm going to talk about chloroquine in a second. It does have some effect on the coronavirus. We're looking into it, okay, but we don't know the dosage. Okay, we don't know the dosage. So some people have used it and died. Some people got the worse. So we're now doing a random clinical trial right now on the chloroquine to figure out what's the dosage and what other medication could it synergistically help. So like if we do use chloroquine, do we use Tylenol? Do we use azithromycin with it? You see it? So each will be synergistic or helping each other to fight the disease. So we don't have that much data yet. So if we now have 1 million cases and we're using chloroquine and 50% of the cases are helping to survive, then that's significant data. Do you get it? So it's a clinical trial right now. I can't say this to that because then if I say this, then 6 months later, Nieto, you were wrong. No, I have to be broad because there's not enough data. Like I said, in the book, it doesn't have anything. So when it goes into the book, then there's significant data and research on it. Are we clear?
Yes.
Yeah, so it's not written yet. Okay? It's not written yet.
So Dr. N, what about the people that are homeless that are out in the world right now that cannot shelter in place?
All right, so let's talk about that. So for New York and California, I got to salute to the governors, Governor Cuomo and the Governor, Newsom, which I think a lot of people don't like. Well, they're stepping up to the plate better than our president, and they're taking their 2 cents in it, where they're acting fast. So Governor Newsom had mandated now like university dormitories, hotels that are being used. The Moscone Center right now, they're going to put makeshift housing there because that's a big convention center, all the homeless in San Francisco.
Wow.
Oh, really? So it's not just people that are infected. It's
no.
All of the homeless.
All the homeless.
Wow. Now that, because I did hear that they were mandating some of the hotels, but I thought it was just for the sick. People that were sick because there was not going to be enough room in the hospitals, that kind of thing.
Okay, let me iterate this. So we're reserving makeshift hospitals, not just for Corona, okay? So we can alleviate some of the Corona cases in the hospital, you know, other than the other diseases. So we're putting, you know, people with other diseases in these hotels.
Oh, gotcha.
Okay, so like the Mercy's coming, it's pretty soon, it's probably in LA now. They're only treating other than coronavirus.
Oh, right. Okay.
So you're gonna isolate these guys from the hospital so they don't get infected. You get it?
Yes.
Remember, we're trying to flatten the curve.
Mm-hmm.
And if Yeah,
have
go
a
ahead.
question.
Yes.
If you have a group of infected people in a hotel
Mm-hmm.
that has the coronavirus,
Mm-hmm.
and I come into the shelter for not the coronavirus, isn't it likely that I'll contract it because I
No,
don't have it?
no. Like I said,
Yeah, they're gonna
separate it.
Yes, they're not allowing regular Joe Schmo to come into those
Designated
those
with corona
hotels. Yeah, they mandated certain hotels, and they're not going to give the names out for coronavirus people that already have the virus.
Okay.
But other hotels will be regularly run as a hotel. So say they're going to pull off the homeless people off the street that don't have the disease, that kind of thing. They'll get to go inside of a hotel and stay there, without the disease. But there's some hotels that are actually set up specifically for people that have it, and we're not going to know the names of those, so people won't just arbitrarily walk into those. They're going to be closed off. You'll know. They're going to keep you away from it.
Correct. Thank you, Candy.
What about
You're
the
welcome.
what about the prisons? The prison system.
Oh, we already released a lot of prisoners.
I saw that. I was like, okay, why?
Yeah, it says on the news they already released some of them.
Yeah, because we don't want them to get infected as well. All right, so so you guys are learning a lot. So what we're doing as infection control, this is an infection control class, is we're isolating those that are positive into one area and other diseases in another. We're not mixing it. We're trying to alleviate the hospitals with the burden of too much patients. So we are now recruiting retired nurses and doctors to man minor things with corona in these.
Some of the doctors are doing like the CDC with this.
Yeah. All right. So, so if anybody, you guys know anybody who's a retired nurse or phlebotomist or whatnot, in fact, the Contra Costa Regional Medical Center is trying to call all the old phlebotomists that quit, and they're rehiring those guys. Brian and Sam, do you guys know Sarah?
Yeah.
Sarah was called by the manager, Fernando, to come in and help out.
That's good.
I know Sarah and Fernando.
Yeah.
They're working at Contra Costa Regional Medical Center.
Yes, yes. So Fernando is the manager, and he happens to be a MD himself. So he's trying to take care of that end over there. But there's financial restraints and supplies. So we're trying to ask for the federal government and the state to supply a lot of these PPEs to these state-owned facilities. Okay, so Fernando can only go so much when he can't get the supply. So we're actually accepting donations from other countries now. In fact, Taiwan just sent how many millions, Nelson, they sent to the world?
You mean 100,000 masks?
Yeah, it was millions, you said, right?
Yeah, it's all the millions, but we're just starting out.
Starting out, because you guys are producing the mask now, right?
Right. It's not made in China anymore.
It's made in Taiwan, okay?
Yeah.
Not made in China.
No.
Oh, good.
I saw that they the United States were cutting ties with Hawaii. They're not going to let them make chips anymore. They're not going to buy chips from them anymore. They cut the contract. They broke the contract with them yesterday. It's going to be unfortunate for them. They're not going to get a lot of sales anymore or anything. And that's just the beginning, they say. Dr. Nieto, you froze again.
Oh, I thought he just smiles a lot. You see,
Look, he froze. That's funny. Yep, there he goes.
He's done.
Yeah.
Somebody's phone.
Why does it sound like someone's calling?
What happened?
He got cut off again.
Nelson, how you doing?
Doing fine. Kind of tired.
Here he comes.
You still remember me?
Of course I still remember you.
First
All right,
time we
Doc.
met in the Philippines, right?
Yeah.
You were in the Guadalupe.
Yeah.
It was,
Pre-mentioned.
Dr. N, when you froze, your smile was still there.
Oh, was
Nelson said, Nelson said, well, I thought he was just like to smile a lot. Welcome back.
Yeah, like I said, I'll probably come in and out. I don't know what. I haven't paid my bill with Comcast. All right, so let's go to where I left off. So where we left off was the last two bullets there of the coronavirus. The first one in 2003 or 4, then the next one about 2012, the MERS. In SARS, there was one animal, and then in MERS, we have the camels. So this is in the Middle East. I forget what the animal was in SARS. Do you remember, Dr. Nelson? Was it the chicken or something?
The SARS?
Yeah.
I think chicken.
Chicken, yeah, the chicken.
Bird flu.
The bird flu, something like that. Okay. And then in the Middle East is the camel, you know, because there's a lot of camels in Middle East. So that's why they call it the Middle Eastern Respiratory Syndrome. And then as you see there, it's SARS-CoV, CoV. So we're the CoV2, okay? CoV2. So there we go. There's the numbers there, 2000, 2003. Zoonotic means the virus that's in the animal. It was first seen in Guangdong in southern China, near Hong Kong. And then it rapidly went to, spread to 24 countries, including America, okay? Today, the COVID-2, CoV-2, like I said, it's the novel virus, novel meaning new, and these are the first pictures that we got back in December, January from China. So, do you see people taking temperatures here in the United States?
Yes.
I do.
Right.
I take my client's temperature every day.
No, they're like taking picture when you go to the grocery store. They're taking the temperature.
Right.
Yeah, I don't see anybody taking temperature at the grocery. I went to Trader Joe's, to pick up what I ordered. Didn't go out, and I didn't touch the bag, so just put it in the back of the back of my trunk. But they're not. I didn't see anybody testing temperature.
No.
No.
But look at this.
In, I don't know, San
The
Francisco,
Philippines everywhere.
temperature for the
Yes, the Philippines everywhere. So we're not we're not that.
So when nobody sit there, so I can finish this class. That's what
So-
I'm trying to avoid. Go ahead.
So the thing is that, you know, why are the initial, can you if you're talking,
Yeah, somebody's talking in the
yeah,
background.
mute your speaker, mute your mic. Anyway, what I'm trying to say about, you know, I know temperature is not a gauge. Hello, can you mute your speaker?
I'm sorry.
So what I'm trying to say is, you know, when this came out in December in China, they already took the notion or the precaution of checking everybody's temperature, even though it might be a different disease. You know, at least they stop you from going to that building. You get it? And infecting people, whether it's corona or not. Have we done that?
No.
No. That's why we're going to get rapid cases. Okay? We're going to get a lot more cases. And in fact, we have already surpassed China's number. Okay? That's how we are not prepared. Okay? So, and look at everybody in, you see pictures today, people still in Taiwan. And if it was the daytime, Nelson will go out there in the street there in Taiwan, everybody's still wearing the mask.
Right.
After 3 months. And we're just following Italy, but now we surpassed Italy. We're now going to be the epicenter of the world, New York. Right after New York, what other state is next? You tell me.
California.
California. But we're trying to flatten the curve. That's why this governor should get a Nobel Peace Prize along with Como. They are initiated the quarantine, whether it's called quarantine or shelter in place, faster than the federal government. Okay?
Yeah, he's getting pissed off. He's ready to bring out the National Guard because people are not listening.
Remember from yesterday's lecture, the National Guard is already in all the middle cities of California, in the right. Fresno, Stockton area.
Yes.
As mentioned by Maria, right, Maria?
Yeah. Oh, definitely. Yes.
So you saw a lot of National Guards out.
Yeah, and not only that, but my mom videotaped. She was at the railroad section where it closed off because there was a train, but they were pulling nothing but tanks on the train. It was tank after tank after tank.
Yeah, they're going to close off Highway 99 because, you know, nobody's following the lockdown shelter in place.
So who mandates, like, is it the CDC that mandates all the stores or everywhere where people are going, like, to stores or pharmacies? Is it the CDC that mandates for them to take temperatures? Who puts down that rule?
Of course, it's the CDC, but, you know, no one's saying anything about the CDC, there. So the states have to do it on their own.
Okay.
Okay, so, but, you know, as in China, there's only one ruler. You get it?
Right.
What he says, it goes. Nobody debates about it. Okay.
Right.
We don't have two parties here, three parties saying, no, we don't want you to do that. Then the other one, we want you to do that and all that stuff. So we're
gosh forbid that we do have the other people, because if Donald Trump was the one that said who goes, we'd be in trouble.
If we follow him, we'll be in trouble. If we open up the churches, on April 1 on Easter, oh man, you know, like thousands of people.
He said that.
Yeah,
and people are listening.
People are listening, especially Middle America.
Right.
Too.
Yeah, so I don't know if you guys watch Fox News. Then they believe in Trump.
Yes, they do.
Okay, so everybody has the right to their opinion, but who's going to have the last laugh?
The doctor.
You know, we should base it on scientific facts, not on gut instinct about the economy. Okay, yes, it's part of the economy going down, but if we don't take care of the virus first, who's going to work? Everybody's dead,
Right.
right? Who's going to work? When you get open economy, who's going to work if you didn't take care of this virus? Everybody be dead. Okay. So that's the thing now. So this is the SARS-CoV-2 that's starting in 2019. Now we're in the 2020. So, you know, as you could read there, it first was identified in Wuhan, the province of China, and it was linked to live animal wet market there that's spreading. So there's a lot of news saying that there was a spill of the virus vial because somebody was trying to buy it, and they exchange in that market, and somehow or another a military came in and tried to stop the transaction, and the virus spilled in the wet market. And now
Wait, what? Wait.
I'm just saying there's a lot of stories like that.
Oh my God! I was like, wait a minute now.
I don't know if it's true or not, but that's what they're trying to do, you know, with who, why is it there, da 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 da.
Right, so, how it got out.
So we don't know. It's just stories, like I say, it's just stories. But you know, in the next 5 years, we'll figure it out.
Doctor, so what about the swine flu?
The swine flu is the influenza flu where we had an outbreak about 5-6 years ago. Remember that?
Yes.
The story is that this scientist in Mexico had the vial. He was researching on it, and somehow or another, it got loose into the public. And so the first cases of swine flu was in Mexico, and it spread throughout the world. You get it?
Yes.
But swine flu is just is a hacking cough. It's not, it doesn't cause really pneumonia.
Okay, so it's not as bad as SARS.
Yeah. So that's why we don't have a pandemic of it last 5 years ago or 6 years ago. Are we clear?
Yes. Yeah.
Let's take a quick break. It's already 10 minutes to the hour of 11. Let's take about a 15-20 minute break. Have your snack or coffee or whatnot, and try to rest up because there's more information that I have to give you. I wish I could give you guys snack through the
Make us some pancakes.
Yeah.
Hey, are we still getting Panda Express for our break?
That's what I'm saying. If I could get the Panda Express into the internet, I could give it to you. You know what I'm saying?
Yeah, I missed that.
As you notice, I'm not as I'm totally serious today. I can't crack that much jokes. You know what I'm saying?
Yeah.
Because you know why? You know who's listening on here is the CDC.
Absolutely.
Dr.
Look, now you got to be good. Oh,
you got to be good.
I should have known something was different. I felt
it was
funny.
different. Yeah,
I did feel funny.
I got to be serious, and I can't.
You got to be a good boy.
Yeah.
Oh my gosh. I knew this was something weird.
I can't be ghetto. And check this out. And I have to give you facts as we have it now, but I have to explain it can change.
Yes.
You say nothing is concrete. What I'm saying. There's nothing concrete. I could give you the pathophysiology of in the next few slides, but that's not going to change. But what's going to change is the compliance of the shelter in place, the medications, and whatnot. But the pathology in the body, I'm going to show you, so that you have the knowledge to